So we're going to start with Deb Mozden. We have two Debs joining us today from Turning Points Network. So Deb, as we all know, we are being asked by our elected officials to stay home and to stay inside, and we recognize that that may create added risks for victims of sexual and domestic violence. So we'd love it if you could take a little time to talk about the last 2 months and what you've seen in your community as the biggest issues facing survivors of sexual and domestic violence and how Turning Points has been responding.
So again, thank you, Lynn. And I would just begin by sharing that the biggest issue facing survivors right now is that this pandemic has created more and new ways for abusers to control their partners and to keep them from seeking services. One of the things that we're seeing pretty frequently is that abusers are not returning children to survivors, even when there's a court-ordered parenting plan to do so. And sometimes I think abusers try to justify it by saying that survivors are still working and could get sick, and so therefore protecting the kids. I think most are more brazen, simply saying that they're not returning the kids, and there's nothing survivors can do about that unless they come home. Just yesterday, one of our advocates advocated for a very young mom who has primary physical custody of her child, and she's not seen her 9-month-old child for 3 months. For 3 weeks. And so again, we're seeing that every day, and we've seen that across the state. We've also seen that abusers have kept survivors home by threatening to take or keep their stimulus checks if they weren't there when the checks arrived. Again, keeping survivors home and under watch. And for many people, the stimulus checks are really helpful. For most of the folks that we serve, they're really critical. We've also seen fear of abusers using fear of getting sick to keep survivors home, but more importantly, threatening them what life would be like if in fact they brought sickness into the household. We've seen abusers using financial control, controlling the finances, if you will, even if the survivor is the only one bringing income into the household. Again, stopping survivors from being able to leave and seek services. There are just really fewer opportunities during a stay-at-home order for survivors to reach out. So in addition to the tactics that the abusers have been using to keep survivors home themselves, they've also cut off contact with friends and family of survivors, so the people who are in a position to help survivors maybe get services. And also, survivors just haven't been aware of services that have been available to them. Again, information has been cut off for them. So they didn't know that courts were still available for orders of protection. They didn't know that crisis centers are still operating their emergency shelters and also placing folks in hotels. So again, very creative in finding ways to keep survivors home, keep them from leaving, and not accessing services. And in addition to that, we've also seen a trend in the statewide hotline calls. And while this could look different across the state, at Turning Points Network, we're really seeing a difference in the tenor in the calls, that most of the calls that we're receiving right now are for immediate needs. So while typically our work would include emotional support and services focused on healing, connecting survivors with other community resources for which they're eligible, as well as crisis intervention, that we're really just seeing that focus on immediate needs. We're being asked for help with financial assistance, with food, with medical assistance, with court advocacy, with emergency housing, with permanent housing, with resources to get to work, just to name a few. We did see a drop in calls in the month of March, and then a significant increase by 44% across the state in April. And the volume of calls probably is not indicator of the scope of abuse and violence across the Granite State, because what we're hearing now is that from survivors who are finally reaching out, but saying that for many of them, that they're still just really trying to hunker down, stay in the same household with their abuser, get through this, stay in the household with their kids as well, until that they can get out permanently, not just temporarily, and also trying to create some sense of normalcy for their kids, because so much has changed for their children as well. Excuse me. And as important, more important maybe, is that through these calls, we are really hearing survivors disclosing serious and severe and repeated abuse, it really does seem that for many survivors, the abuse during this pandemic has significantly intensified. So these are some of the bigger issues that we're hearing from survivors and seeing that they're facing right now. In addition, crisis centers are really looking ahead, as Representative Addis mentioned earlier about going forward, that this isn't just about now, but also going forward. And crisis centers are really trying to figure out what are survivors going to need in the next few months as well. And so even though there's an emergency now, we're expecting an even greater emergency when the stay-at-home order is lifted and we reopen. In particular, we know that more and more and more survivors are going to reach out for emergency housing, for limited emergency housing. We know that the Child Advocacy Center will schedule interviews for all of the kids who are suspected of being physically and sexually abused. Right now, Child Advocacy Centers, ours, I know at least for ours, they're really screening heavily and only interviewing those kids at DCYF determined to be at the highest level of risk. And so all of those interviews are going to have to be scheduled when it's safe. So when we all reopen. We also know that when children resume normal activities, if you will, such as going back to school or this summer being at camp or in childcare, and more adults have contact with kids, that we're going to see incidents of child abuse just skyrocket, or reports of child abuse skyrocket. And for those families experiencing child abuse who also experience partner abuse, we will be involved with all of those families with DCYF. We all have a family violence prevention specialist at our organizations co-located with DCYF, working with families experiencing both child abuse and partner abuse. And it's just for perspective, right now, while calls are down, both for crisis centers and for DCYF, our family violence prevention specialist is working with Child Protective Service workers on 61 open assessments. That's what's happening now. So we know that those numbers are also going to skyrocket when we reopen. Court advocacy will certainly be in demand as well, and countless survivors are going to be asking for assistance with permanent housing. So again, all of that when we reopen, and we anticipate across the state that that surge for these needed services will likely last for several months. And I too, just in closing, would like to thank everyone who's participating today, really wanting to know what survivors are experiencing right now. Deeply appreciate your engagement. Thank you.
Thank you so much, Deb, and thank you for the really life-changing work that your staff, and I know all the crisis center staff, are doing.